Hello.
Hi, how are you?
I'm great. Thank you, Dr. Natbony. How are you today?
Doing
All right. We're all ready to get started?
yes.
All right. So today's the last part of our four-part series for migraine and exercise. And today we're going to be talking about integrating exercise with medical management for migraine. So hello, I'm Dr. Sam Kelokates, and I'm a physical therapist based in Philadelphia that treats headache and migraine disorders. And joining me is Dr. Lauren Natbony, owner of Integrated Headache Medicine of New York. And she's also an assistant clinical professor at Mount Sinai's Icahn School of Medicine. Thanks for joining me.
Thank you for having me.
You're welcome. So let's just jump right into it then. One of the questions I have for you is how does physical activity really complement the medical treatment plans that, like your other neurologists, prescribe for patients managing migraine?
So I think that we have to think of it as a toolkit, right? Like as their toolkit, and exercise should be part of that toolkit. So you will have your medical management, taking medications, for example, but how do we make lifelong change and have that be sustainable? We think that by adding in exercise, even if you were to come off the medication or if you were something were to change, we can still maintain the exercise or other lifestyle factors there to help keep things stable. So it should be part of every treatment plan.
Mhm. Great. Yeah, I agree with that. And I think it's something that's foundational and that is that you come on and off medications depending on where you're at your point of life. But something like we say exercise in this instance, but really just all physical activity.
Yes.
Being more physically active should be a cornerstone of just a healthy lifestyle in general. But really for those with migraine, it can be a really great way to help manage and improve your quality of life in the long term as your migraine changes throughout your life.
Absolutely.
Good. Some maybe you've seen with patients in trying to balance exercise with their medication schedules, or is that not really a problem patients have for you?
So it's a good question. I think that balancing exercise is an issue all on itself, but I think if certain medications make people tired or if it makes them nauseous, then that could hinder exercise at certain period of time. But it hasn't been something I've really run into. It could be more the acute medication when someone takes something and it makes them tired. They're not going to miss their scheduled exercise class, but again, doesn't seem to be a huge issue.
What medications tend to have those side effects for patients?
Really variable depending on the patient. For acute treatment, most patients tolerate triptans just fine, but some patients find that it makes them a little bit tired or a little bit nauseous.
Mhm.
And the migraine itself, the migraine hangover, can make people tired.
Yeah.
So, which the medication, what's the migraine, sometimes it's hard to know. Some of the ones that we use are more sedating, like muscle relaxant. Sometimes will make people tired. Really just depends. But for prevention, usually preventative medications like the tricyclic antidepressants can cause morning fatigue. But again, it's something we could usually account for and we can change the timing of the medication to overcome it.
Gotcha. And with these medications, is there any time they shouldn't exercise with those symptoms, or is it okay to exercise, and does exercise even help those symptoms?
I feel that there's no reason to not exercise. If you're going to be running outside in the dark and you're tired, maybe that's not such a great idea. But I feel like as long as you're doing it safely and responsibly, totally fine. And fatigue in general can be helped by physical activity, regardless of what the fatigue is caused by. We know that getting the blood pumping and moving
Mhm.
can help in the moment. So I would say if you're tired, it's okay. I feel like we're all tired at some point.
Yeah.
Doing exercise can actually help push through it.
Yeah. I think the only interaction I've seen with medications that's something that I'm aware of and I build into patients' programs and talk with them about is if they're on beta blockers for migraine, and that's where beta blockers blunt heart rate response to exercise, so we can't use heart rate to really monitor their exercise prescription in those cases. So we really need to use some other ways to manage intensity, and usually that's using like rate perceived exertion or RPE.
So a question about that, because the doses that we use sometimes really don't change heart rate that much. Yes, maybe it's lowering the baseline and they can't get up to the
Mhm.
maximal heart rate, but do you find that the doses we use is enough to make a significant difference where tracking heart rate is not as predictive?
I haven't noticed that, but I can't because of like literature I am aware of is that like they're taking a beta blocker, it has the potential of changing their heart rate response to exercise. So in theory, it's making that a little bit less accurate to use a heart rate monitor. So I want like to start looking at it and monitoring it, but I want them to be able to use an RPE scale in that case because
Makes
that would be
sense.
a better way to manage intensity for them.
Absolutely. Good point.
How question would be, how should patients what their current exercise habits are, and their effects to their healthcare provider so that their headache specialist or neurologist can better help them in their treatment plan?
So I think talking about exercise as a discrete trigger or exacerbating factor, like I think coming out and saying blatantly exercise makes it worse. Well, okay, but there's specific times. Let's say I want to do exercise of more moderate to intense activity 3 days a week. Is there anything I can do that will maybe prevent or support me in doing that to be able to allow me to continue through the exercise? I think telling your doctor exactly what you're looking for. Obviously, there's no magic bullet in saying, how do I exercise without triggering pain? But are there things that I can do or adjust or medication wise that might support me in that endeavor?
Yeah. And then on my side, like I'm talking with patients about that, I'm asking, soon, during, or after onset is a headache or a migraine attack occurring? And the further it gets away from that time of exercise, the less likely I feel like it's the actual exercise itself. And there's a lot of other things that go into a migraine attack. The closer it is or during exercise, it's more closely aligned to that's the trigger itself, or you're having exercise or a physical exertion type attack. That then we would manage by adjusting your intensity to make sure we don't hit that threshold for you. And then we start kind of pushing into that as we've gotten further and further into a program to not trigger as often at those intensities.
I think that's what's so unique about you is like as doctors, unfortunately, a lot of us, there isn't time to really explore all of this.
Hmm.
So I think knowing that the doctor definitely wants to help and wants to be able to intervene, but sometimes it is a process and it's working with physical
Hmm.
therapy, someone who's more versed in doing this every day that can really be helpful. But from a medication standpoint, you can definitely say, okay, you can do before, here's what you can do during, here's what you can do
Hmm.
after, and then telling us when when the headache or migraine attack starts. That is really useful information.
Yeah, and I think that's how we look at how myself looking with neurologists is like trying to figure out how we mitigate that and not have the attacks occur, but then working with the neurologist on what should the medication plan be for if that attack occurs to one abort it as quickly as possible and then make sure it doesn't occur into like more chronic attack for them.
Absolutely.
What advice do you have for patients who are hesitant to exercise due to concerns that it might like affect their migraine status?
I think we talked about this a little bit before. I think I was telling a patient before, I'm like, risk with everything. Crossing the street is a risk. Like, wake up every morning still has risk. There's always things that can happen. And we're not going to know the positives of doing something until we at least try it. But trying and taking off small chunks at a time, I just try to empower them to say it's okay to feel that way. Like, okay, we're all feel that way, but we
Mhm.
have to try and then learn how it's okay if it triggers a little bit of pain. Then we can modify and change it a little bit the next time. But pain is a normal part of human experience, and it's something that is scary, but at the same time, something that we can learn and teach our brains to be able to push through for exercise
Yeah.
purposes.
And I think that's where like the some like science education really comes into play there, like teaching people what does your pain mean? Is it
Mhm.
saying you need to back off? Is it saying you need more of something else to support you? Like you have neck pain with it. Do you need more neck pain or do you need a better warm up for your neck muscles and shoulder muscles to support you during an activity so that doesn't trigger neck pain that triggers your attack? And like is your pain trying to communicate with
Yep.
you? And sometimes I feel like we've grown up in a world where like haven't really taught ourselves how to like take in our like awareness of like what does our neck pain mean, what does our dizziness mean, what does this headache mean, and how should we effectively respond to that sensation.
Absolutely. I think our natural response is pain is bad, and we need to run away and avoid pain at all costs. But actually, pain is telling us something, and everyone's body is giving them a message.
Mhm.
And learning to interpret that message is half the battle. And knowing that if we can figure out how to interpret it, doesn't mean we have to avoid the activity, it just means what do we have to give our body in addition to make it function at that time.
I guess one of my next questions is how can we as like healthcare providers, because I'm sure there's other healthcare providers that'll watch this now or later, how can we better support our patients in implementing and integrating exercise into this total comprehensive migraine plan?
I think we need to ask patients about it because I think a lot of times patients keep track of things. They have all these questions, and it seems like maybe we're not engaged in really getting that information out of them. So I think that making patients accountable and sort of saying this is not placing blame on them, it's just basically saying, hey, I want to know how you're doing. I want to know you as a person and what I can be doing as a doctor to support you.
Hmm.
So I think it's just asking the questions and having the conversations and acknowledging and validating the experience.
Yeah, great. Yeah, definitely. I think support's a big thing, and then removing concerns. Like I think that's a lot of pictures. Like I don't know what to do. I was told to exercise, but what, when, and decreasing those concerns or that lack of awareness or that uncertainty really improves patient engagement. At least for what I do with clients, is just like them figure out what's good for them, what works for them, and like make it really understandable and breaking it down into much simpler tasks for them.
I totally agree. I think also a lot of what we do as doctors is try to give this comprehensive plan of attacking everything. And a lot of times it's overwhelming. And I think just being able to support the patient in starting and having them meet small goals is important, and just accountability. So I feel like just being able to say concerns are valid here. I'm going to prescribe for you doing X amount of exercise to start with, just
Yeah,
something.
that's great. In your experience, what's been kind of impact of regular exercise or physical activity in general for those with migraine and like how it affects their frequency and intensity?
So I will say it changes things across the board. So yes, we're always looking for a frequency intensity improvement. And I think that that comes a little bit later. I think what comes first is the self-efficacy and
Mhm.
feeling this sense of, okay, did something. The overall just sense of being starts to feel better. I think fatigue starts to get better. And then over time, it's months.
Mhm.
Then I start to see a decrease in frequency, or that when they are happening, it's more easily treated with rescue medication. So I think it's a bit of a process, but I think exercise, anything you do at first, is a job and it's a chore. But I think once it starts becoming part of the routine, that's when I see the bigger changes from a migraine frequency perspective.
Yeah, I definitely agree. I think like I was thinking back on like this affects like the clients I work with is that the things we see a bigger change in earlier than headache frequency or intensity is quality of life or level of disability, where like pain or frequency of headaches is still more often, but they're doing more with that level of pain that they have. And they're able to better tolerate it. And then as they're able to do more, then they start adding in more exercise, or they add in more physical activity or more engage in more things they enjoy, and that's where we start seeing that frequency decrease for them.
But even aside from frequency, I think it's also important to say that quality of life is also, I actually think, is a more important metric
Hmm.
necessarily than frequency, because we all will experience things that are uncomfortable, but if we're able to function and it doesn't affect our quality of life, that's what's really important. So I have patients who are still chronic, they still have chronic daily headache, but they tell me I'm functioning. I feel like it doesn't impact me as much. I'm able to sort of more in towards the back of my mind and get through the day. And for someone who has chronic pain, that's, I feel like, a huge step.
Yep.
I just don't want to say that everyone's going to have this improvement in frequency, but improvement in quality of life should really be something we're looking for.
Yeah. Now, and I know the answer to this, but I know some patients watching might not. Can exercise regularly cure migraine?
There is no cure for migraine. Migraine is a chronic neurological disease. Chronic meaning it is there for your life. How frequently it happens and how severe it is will change over the course of your life. If I had a cure for migraine, trust me, I would share it with everyone. But we are looking to manage pain and sort of quality of life. So what happened? Oh,
I forgot to put this on Do Not Disturb.
it's okay. I have this nice beam of light coming in. So I feel like there's all these things coming from other angles.
Yeah. What you want to add about integrate how like as both a physical therapist or like a rehab professional and neurologist could better work together to help patients to really integrate exercise into the medical management plan?
I think that from a physical therapy perspective, if you notice that the patient is having trouble with something, like then communicating to the doctor and saying, okay, this is the obstacle I'm trying to overcome. From a medication or medical standpoint, are there things that we can be doing differently? Like, for example, I use lots of different treatments before exercise, but some patients find that doing a dose of magnesium beforehand, especially if they're going to do things that are more muscle intensive, or some patients who you were talking about the beta blockers, but that who have a very exaggerated heart rate response. I'll use like a small under the tongue timolol eye drop, for example,
Okay.
or in the eye drop to sort of help modulate that response. Is that breakdown? Is it that they're feeling sore, out of breath, the neck, that, like you said,
Mhm.
sort of figuring out where it is in that pathway the breakdown is, and then how we can try to help with it.
That's great. Any other thing? I think Those are all the questions I have. Is there anything else you want to add this conversation that I hadn't asked yet?
Yes. I just think I want to end like series by saying that exercise, I think, is probably one of the scarier things that we tell people to. Not scary in terms of like, but it feels so overwhelming. It just feels like I just can't. And I want to validate that and say that is totally valid and it feels that way. And I think that it's really working with the right people and having the right support that makes things successful, because you can have totally different outcomes depending on the people that you're working with and the people who are guiding you. So if something isn't working for you right now, doesn't mean it won't work. It just means right now in this situation, what you're doing isn't working for you, but doesn't mean that we shouldn't try another situation that might instead work, because a lot of this is trial and error, and each person is unique. Each person's body chemistry is unique. What they need is unique. And it's our job to find out what that is.
Yeah, here's with something I talk about a lot is that there's the exercise prescription. There's a science for that. Like, how much do we need to really stimulate physiological change in the body to improve your health and wellness? But then there's an art side to that. Like, how do we find how to fit that prescription in to your individual lifestyle and your needs? Like, do you have kids? Do you have family? Do you work full time? In your living situation, can you go to the gym? Can you afford that? And there's all these different things that we need to factor in and take into account that really like science and research doesn't really account for on papers, and that's where like practitioners, that's where our skill really comes in on how to work with somebody on an individual level.
100%. I call it personalized precision medicine. And I think that's sort of something that I've really tried to do in my practices. The things you recommend will only work if the patient is able to do them and integrate them into their life. Whether it's medication, whether it's a lifestyle intervention,
Yep.
even the science is there. If it's not something they can do, it's not going to work. So getting to know the person and seeing how you can sort of any barriers and what works specifically for them will give a better outcome. I know it takes time, it's hard, and I feel like some people don't even know what themselves as well, but that's where sort of closely with someone like myself can really help.
I
So
agree.
yeah.
Great. Well, thank you for talking with me today again, Dr. Nabony. I really appreciate it, and I hope that people watching this really learned a lot from and take away some stuff to really get active again with migraine.
I hope so too.
All right. Thank you, and have a great day.
You too.
Bye bye.